Good evening, ladies and gentlemen, and welcome to Bahrain Now with me, your host, Lar Sam'an. We've got a great show coming up featuring great local talents, initiatives, and happenings from around the kingdom. So stay tuned, we'll be right back. A lot of us experience teeth sensitivity and toothaches during Ramadan. Let's get to know why as we welcome Dr. Mohammed Gahtan. Hello, doctor, and welcome to our studio today.
Hello, welcome to invite me again.
So, doctor, can you tell us, in the month of Ramadan, many people experience toothaches. Can you please explain why?
A lot of people complain from toothache during Ramadan because when they are fasting, they stop eat and drink for a long time. You are talking almost 13 hours regarding to Bahrain time. This is give big chance for analysis of the food, for food referring to change to acids. These acids can by time affect the tooth, affect the enamel of the tooth, and by time cause dental caries, dental cavities, and this is cause pain. They need to go to the dentist to fix this problem.
They have to fix it. And you're saying, doctor, because we're not eating or drinking anything for 12, 13 hours, so our mouths just like become drier, so the food just tends to stay there.
The remaining food, that's this transfer to acids that affect the teeth. Yeah.
Okay. And can you tell us, doctor, of course, all of us love tea and coffee, and a lot of us drink a lot of tea and coffee during the month and suffer from yellowness of stains. Is there any way to help those stains?
Just
don't
brush your teeth. Brush your teeth very well, especially before start fasting. Try to choose a good toothbrush, good toothpaste, and better to go to dentist before Ramadan for regular checkup and the cleaning.
Yeah. But like me, I'm somebody, I love to drink coffee. Okay. A lot of coffee. But of course, I want to try and avoid as much as I can getting those yellow stains.
Okay, during Ramadan, you can take the advantage to reduce the amount of coffee and tea because you are fasting. And the best drink ever you can drink in all your life, Ramadan and out of Ramadan, is water.
Water, of course. Yeah. Of course. And can you tell us, when patients experience a lot of pain during fasting, what can they do to help relieve this pain?
Help relieve this pain. The best thing, go to dentist direct, because there's many procedures now doesn't break fasting.
Okay.
And dentist can give you intramuscular injection, can give you anesthesia injection to reduce the pain. And if you are in home, you can put warm compressor or ice compressor. But this is regarding to the pain.
Yeah, depending on how hard the pain is.
Some pain increase by ice, some pain increase by hot bandage. But better call your dentist, go to him direct. There is many things can present to you without breaking your fasting.
Okay, which is amazing. So people who have pain, there is ways that they can sort it by coming to you.
Because now there's many procedures, many treatments, and the clinic doesn't break the fast.
Okay, that's good, because I'm sure a lot of people experience this pain and automatically think, oh no, now I need to take something, now I need to take a painkiller or something.
Let's go to your doctor.
Speak to your doctor straight away. What are tips can you share for healthy fasting without teeth issues? That will avoid it.
Healthy fasting. Healthy fasting, focus on your healthy food. Don't make Ramadan as a food celebration.
Try to avoid the sweets.
Try to avoid any. It's a very big chance to recorrect your food system. You recorrect your biological system from iftar and after iftar. Don't try to eat a lot food and the sweet. You can divide the meals to 3-4 meals each 2 hours. You can eat a little. Don't eat big amount in one time.
And try not to eat so much oily and sweet foods.
And before, at late night, before start fasting, brush your teeth very well, floss your teeth, use your mouthwash, take care with your oral hygiene very well before start fasting. This is very important thing to prevent any remaining food between teeth and give it chance to change to acids.
Okay.
This is the most important thing. Brush your teeth before start, and also drink enough amount of water. And don't stay under sunshine for a long time. Try to wet your body.
Stay in cool places.
Stay cool,
Yeah.
stay in shadow.
Okay, amazing. This is something that we all have to focus on because, like you said, it's
Yeah.
food celebration.
Food celebration.
Yes, it's a food
This is
celebration.
what's happening.
A lot of people do veneers. Do you recommend this to a lot of patients?
This is a big question. Recommend or not recommend? It depends on the case.
Okay.
Each patient is a separate case. So when we have patient, we have to give him, in the first visit, full analysis about his case, full checkup, to listen from him. And this is very important to listen from him. Why you want to do veneers?
The veneers, yeah.
When I say veneers, I mean ceramic veneers.
Okay.
This is very important because also there is something else called composite veneers.
Yes, that's what
Composite
I usually
veneers?
hear about. Yeah,
Composite veneers, I don't recommend it at all.
Okay.
At all. This is a very commercial thing. It's after a short time.
You have to change them.
Change the color and it's broken. Veneers, in fact, veneers is a very thin layer of ceramic. It covers just the outer surface of the teeth. Why? To repair color and shape, and in special cases also the position of the teeth.
Yeah.
That should be ceramic. It's very thin layer. The composite veneer, no. The real veneer is a ceramic veneer.
Ceramic
This
veneer.
very thin
Okay.
layer. But we need patience. So we need patient in the first visit to sit with him, to listen from him, to take X-ray, to take some photos, to make full analysis of his case, to know what he has. Because, for example, if patient has severe gum recession, veneers is unuseful for him.
Okay.
If he don't take care with his oral hygiene,
How will he take care with having
Oh,
veneers
yes,
as well? Of course.
here in this treatment, we have two terms. We have indications and contraindications. Indications means this patient has this problem, he has to do this.
Okay.
Contraindication, this means this treatment is unuseful to this patient.
Okay.
So we want to know exactly the veneers is indication for this case or contraindication to this case.
All it depends on each person. Everyone
it
is
depends
different.
on each person because also you have to explain everything to patient. Also, for example, some patient has trismus, they are biting the teeth through the night. Veneers is unuseful for him. So you have to choose the patient and tell him veneers is suitable for you, is not suitable for you. You have to explain. If he has a trismus, bruxism, he will bite. By time he will break the veneers.
He'll break down his veneers, yeah. So that you can't do that as well.
And also there is very important thing, if the patient has any problem in situation of the teeth, the situation of not correct and regular arch, he needs orthodontic treatment. He needs braces. If you need the braces first, don't go to veneers. Do the braces, finish from braces,
and then
go to veneers.
Yeah.
This will make veneers much more beautiful and much more perfect. And the oral hygiene in the future and the cleaning, it become better, and also your gums will be very, very healthy. Don't think veneers can correct everything. Don't look at veneers as a magic thing. Veneers, there is certain indications for it. We have to explain it's a very thin layer from ceramic. It's attached and adhesive to the teeth by chemical material, but the fixation is a chemical material. And you have to know there is nothing forever.
Correct.
Even if you fix veneer, you have to take care very well. You have to consider maybe in the future it will come out, you have to fix again.
You have to be careful of what you eat as well, correct? Just
yes,
in case?
yes, of course. And you have to be careful about your gums because if you don't take care, your gums shrinks, the roots exposed again.
Okay.
And this is yellow color.
Oh,
over veneer. Then veneer will, you have to change the veneer.
Okay, so then just you're going to keep going back and forth, back and forth.
Yes. But you have to explain all this point to patient, tell him everything, clear, still decide, go ahead.
Okay.
And this is veneer. So again, the real veneer is a ceramic veneer, not a composite veneer. Composite veneer is a fake thing. Don't do it. I don't recommend it at all.
Okay, that's the most one I always hear about.
Yes.
What about teeth whitening? Do you recommend teeth whitening?
Teeth whitening.
And is it very sensitive to the teeth?
Okay. Teeth whitening. First, we have to recognize between teeth whitening and teeth cleaning.
Yeah.
Teeth cleaning is to clean teeth from calculus, stains, spots, and return teeth back to original color.
Yeah.
Teeth whitening is to make the original color whiter.
Yes.
Teeth whitening, there's many materials in the market and there's many systems. There's home bleaching, there's bleaching in the clinic, there is also many brands, many things. But the teeth whitening can give you 2-3 shades more. And if you need whiter, you have to do the session again.
Again and again, yes.
It causes sensitivity or not.
Depends on the person.
It depends on the person first. Depends on his healthy gum, if he has any gum problem or not. Also depends on his lifestyle, kind of food and drinks which they are using. It's normal. There is normal complication happens during and after the session. There is sensitivity happen, like patient can feel with like electricity.
Oh wow!
Like a little bit, not too much. This is normal after the session. Also, maybe he can see white spots near the gums. This is irritation, gum irritation, and this is normal. It will disappear within 2-3 days. Teeth bleaching, give him 2-3 shades in one session, 2-3 shades more. There is little bit sensitivity. It reduces it gradually, and any patient has to know exactly the teeth whitening will not stay forever.
Of course.
It's just for a few months.
It's a few months, and then it will go back, of course, back to.
If you drink coffee a lot, if he's a smoker, if you don't take care, if you use not good toothpaste.
It will go.
This will, it will go.
Yeah.
I recommend, especially if any patient wants to do teeth bleaching or teeth whitening, better to do it if you have a party.
If you have a special occasion.
Special occasion, do it before 1 week, not before 1 day.
Yeah,
because you will
just in case.
To avoid the sensitivity, to reduce any complications happen. Do it before any occasion, before a few days, 1 week, it's okay. It's okay.
Okay, amazing. I need to think of that soon because I want to do teeth whitening, but now that you said it that way, I'll only do it if I have a special occasion.
Most welcome, anytime.
Yeah. Doctor, is there anything you'd like to add before we end the segment today? Anything you'd like to tell our viewers? Brush your teeth.
Brush your teeth very well. The main thing is awareness. Increase your awareness. Take care very well with your oral hygiene. Teeth brush, flossing, mouthwash. Regular checkup and the cleaning is very important with your dentist. When you want to go for any treatment, try to collect complete idea about this treatment with positive and negative points.
Yes.
You have to know everything about it.
Yes.
Everything about it, then decide. Again, if you want to do veneers and you have a problem in position of teeth, braces first. Try to do orthodontic treatment or braces first. The veneers later will be perfect. Will be perfect.
Okay. Thank you, doctor. Hopefully we'll all remember brush our teeth all the time.
Thank you so much for inviting me. Thank you.
You're most welcome. Viewers, stay tuned. We'll be right back. Most individuals seize the month to start a new fitness journey such as weight loss, goal or muscle gaining, a kickstart to a new healthy path which serves the mind and body. We will learn about more meals plannings and portioning with Sandy. Welcome again to the studio.
Thank you. Thank you for having me today.
So, can you tell us how can we start and what do we look into first in the terms in nutrition and dieting?
See, usually I advise my patient to go for adequate balanced diet.
Okay.
To focus on the quality and the quantity of the food. The quality to be healthy, the quantity depends on too many variables.
Yeah.
Age, height, weight, general activity during the day. So we can go for all the food group in adequate balanced way.
Okay, not just because the quality is good, that means you should have so much quantity.
Yes.
Yes, because a lot of people have that in mind. Okay, I'm eating healthy, but they might be eating a little bit too much of the healthy food. Yeah. So you recommend that it has to be both balanced.
Yes.
Okay, can you tell us what do you recommend is the best time to exercise in Ramadan?
Usually in Ramadan, it depends on the personal preferences. So, however, if there is advantage and disadvantage to do exercise in different time a day. But if we want to go to talk about doing exercise after suhoor, the advantage of doing exercise after suhoor that you have energy after suhoor meal. But the disadvantage, you will run the risk of feeling dehydrated.
Yeah.
Okay, and you don't have time to hydrate yourself, take more fluid until the iftar time.
Correct. And if somebody wants to work out before iftar, what would you recommend? How much time before?
It depends on the physical activity that the individual do before Ramadan.
Yeah.
If the person is sedentary, inactive, usually the aim of the exercise is to be more active. Not to push ourselves for a new record or a new
try to challenge themselves. It's, they shouldn't be doing this to themselves. Okay, so you recommend if they want to do it before
short walk you can do, or if add a new routine to your daily physical activity, like instead of using the lift, use the stairs.
Okay, just change your daily activity in that way. And what would you say is the difference between exercising pre or post iftar?
Pre iftar, as I said before, it have advantages and disadvantages. If you want to do exercise before iftar, you will have the chance to recover, because the iftar meal you will drink water, drink more fluid, eat,
give yourself some energy as well.
But the disadvantage is if you will do before futur, you will feel thirsty. You may get the dehydration symptoms, like you will feel dizzy, you will not feel comfortable.
You might go back feeling sick, that you don't want to actually eat as well. That's another thing. And can you tell us, what about nutrition? What are the foods we should focus on this Ramadan? What would you recommend?
For me, I will tell you to avoid fried food.
Which is the hardest?
Yes, sambusa, spring roll, fried chicken. Avoid it. Too much sweet now in Ramadan.
As well, very hard for everyone to avoid.
Yeah, try to avoid sweet. Don't use too much salt in your cooking, while cooking. Avoid pickles, avoid salted cheese, especially at suhoor time.
Okay, would you say, is there anything you recommend for people who have a sweet tooth like me? I love sweet things. What can we have instead?
Add more fruits to your daily diet. Okay, and you can go for apple, banana. If you want to go for sweet, don't go for example, the heavy Arabic sweet.
Yeah.
You can take jelly, you can take muhallabiya instead of luqaymat, qataif.
And it's very hard for all of us to avoid that because we all love having sweet things. Yeah. So it's like, okay, I want to have, but would you recommend, since you always say quantity, would you recommend for people to balance the quantity if they want to have these things?
If you want, for example, today your mom did luqaymat. You can go for 3 to 4 pieces.
Not 8 to 10.
Yeah. Instead of a big amount, you can go. Instead of deep fry the qataif, bake it in the oven.
Yeah.
Better.
Yeah. And change it in a different way.
You can change the way you cook the food.
Okay, which is amazing. Actually, I never thought of baking it. It's a nice way of eating it as well. And people who want to lose weight, why is it effective for them this month?
Because it will help, because you are fasting a long hours, right?
Yeah.
But the problem is the futur meal. So focus on the futur meal, what you will eat on futur meal.
Yeah.
Try to include all the food groups. Don't focus on the fried food items like sambusa and spring rolls. Take from all the food group, but in a good quality and quantity. Like you can take 2 sambusa with half cup of soup.
Yeah.
Go for salah, watch TV, do something, and after that take your meal, main course. You can take majboos, you can take tharid, but in the
smaller amounts, smaller quantity. And you recommend that people have a little bit of a starter and then continue, have a break and then continue eating, not straight away. Yeah, because a lot of people think that they should, let me straight away eat.
Yeah, they will start fast, they will eat too much. Try to eat slowly.
Okay.
And chew well.
Yeah, of course. So you can so your body can digest it as
Yes.
well. Is there any last advice you'd like to give to our viewers today?
Yes, eat, rest, and exercise, but in strategically. Okay, rest. It's important, but be sure that you are stay awake enough to get the good nutrient and fluid that your body need. Do exercise, but choose the perfect time that you feel okay.
Your body can handle
before
it.
iftar, after iftar. Don't forget to stay hydrated and listen to your body. If you do exercise and you feel dizzy, that is a sign of dehydration.
And it means
so
stop. Yeah.
Yes, stop doing exercise.
Okay. Thank you.
Okay.
Thank you. Thank you, Sandy.
Thank you.
Viewers, don't go away. We'll be right back. Well, everyone, I hope you all enjoyed that episode as much as I did. Don't forget to reach out to us on our social media accounts shown below and stay tuned for more happenings right here on Bahrain Now. I'm Lara Sam'an. Good night and God bless.